Assalamualaikum and hi, my name is NURUL FAZIRA binti JAMALUDIN.
Assalamualaikum warahmatullahi wabarakatuh. My name is INTAN NORDIANA binti ZAINAL ABIDIN.
Hi, Assalamualaikum. My name is WAFIQAH binti OTHMAN.
Hi, my name is SABRINA binti Muhammad SUHAIMY.
Assalamualaikum and hi, my name is FALLAH binti Muhammad LIEZUARDEE.
Nowadays, all over the world is affected by the coronavirus called as COVID-19, which led to all countries need to face the crisis from all sectors including political, economic, health and defense. Cases in Malaysia keep growing and breaking the records that has reached 50,573 confirmed cases and 144 deaths on July 23, 2021. Meanwhile, 10,094 cases have recovered from the virus. As many as 7,780 cases are in intensive care units, which 456 cases needed ventilatory support. Malaysia is in critical condition, and according to Datuk Dr. Nur Hisham Abdullah as the Director General of Health, Malaysia are expected will reach as much as 20,000 cases in future. Companies that are operating in sector healthcare and life science are trying to work harder and collaborate with the person who are volunteered to meet the requirements for coronavirus prevention, preparing for in terms of medical and others. The first reported that found this new virus was identified in Wuhan, China in December 2019 and started spread around the world, leading this pandemic. Coronavirus or COVID-19 is a contagious disease that has signs symptoms to people who have been infected will get fever, cold, headache, fatigue, breathing difficult and loss of smell and taste. People who are vulnerable to the virus are from older people and children. The COVID-19 will be more terrible to an extent can result infection, can cause pneumonia, severe acute respiratory syndrome and sometimes death. People or those that have medical problems including diabetes, high blood pressure, cancer or chronic disease are more prone to handle serious complications. All people are advised with the basic ways to prevent the disease, which are protect themselves and others from the virus are going to spread by always washing of hands using soap and water, keep sanitized hands and other things, do not touch the face, covering nose and mouth with mask, avoiding close contact and keep a distance of 1 centimeter. It is not just ordinary people who have to deal with this pandemic, but health workers are the earliest person to deal with coronavirus. They are directed to take care of patients who are infected until they are free from the virus in their body, even though inadequate medical equipment such as ventilatory support and no further discovery of medicine to eradicate the virus. Also, they are more exposed to hazards that put them to easily infect of the virus because they are at the front line of the COVID-19. The situation is getting serious because there are issues that are many doctors and nurses have died infected of COVID-19. Hazards that are faced include long working hours, psychological distress, pathogen exposure, physical and psychological violence, stigma, fatigue, occupational burnout and more. The objectives in the statement, the first one is to provide adequate medical equipment and supplies fully, including masks, gloves, gowns, hand sanitizer, soap, cleaning supplies and other equipment needed to help workers that are handled to treat the patients of COVID-19 for their safety. The second one is to give advising to workers to take a break if they are tired or feel ill, to stay at home. The third one is to arrange working hours properly with the breaks to avoid long working hours for workers. The third one is to provide information, instruction and training for workers of occupational safety and health, especially refresher training so that the processes are smoothly to treat the patient while protected themselves on ways to use personal protective equipment. And the last one is to give advising to the workers to keep strong and relaxed to handle for confirmed COVID-19 patient without stressing themselves.
Hazard or risk of COVID-19. A hazard is an inevitable danger or risk, although predictable. It may expose a person to the risk of harm or occupational illness. It is to provide a cost-effective, practical, scalable, and adaptable system for identifying, assessing, and controlling COVID-19 infection risk in the workplace. The risk assessment phase purpose was to examine and prioritize the COVID-19 dangers discovered during the recognition phase. There are such categories on COVID-19. Firstly, low risk. This job do not require close contact, only a distance of 6 feet for 50 minutes or over 24 hours when with others. This job also have only a minimal numbers of employees as well as when with the public, for example, health workers who provide telemedicine service. Secondly, medium risk. The job that need to have close contact more often when in community contagion areas. For example, workers at retail establishment, grocery stores or supermarkets, pharmacy, transit and transportation operation, law enforcement and emergency response operations, restaurants and bars that have frequent outdoor, well-ventilated interaction with the general public. Thirdly, high risk. It is a job with an increased risk of exposure to known or suspected SARS-CoV-2 sources. For example, hospital staff who need to enter patient rooms are exposed to COVID-19 patients. Moreover, ambulance workers who have to pick up COVID-19 patients and have to sit in the same vehicle, and the staff who have to manage the COVID-19 corpses that have died. Last but not least, very high risk. This occupation has a very high risk of finding an infection because it is exposed to many patients who are either infected with COVID-19 or not. Examples of these workers are the employees that work in hospitals such as doctors, nurses, dentists, paramedics, emergency medical technicians who need to perform aerosol production procedure. For example, intubation, dental examination, CPR on patients who don't know whether the patient is infected with COVID-19 or not. Overview of hazard. Hazard control refers to workplace practices that are implemented to reduce injury, poor health impacts, and damage to plants or equipment. Many industry hazard management methods are standardized and taught to managers and safety personnel. Hazard control program measures are necessary to protect employees from exposure to materials or systems, as well as training and process to monitor occupational and health exposure to dangers such as chemicals or other forms of hazards such as vibration and noise. There are many controls that can effectively protect employees while at work, such as reducing safety and health risks, assisting employers in providing employees in a safe and healthy condition, and assisting in the prevention of disease, accident, and dangerous incidents. There are measures provided to help employers prevent and control the hazards that have been identified in the workplace. Then, utilizing a hierarchy of controls, it can discover and evaluate hazard control choices. Thus, the organization must utilize hazard management techniques to execute control selection and education, as well as follow the plan's guideline. Last but not least, examine new technologies to determine if they have the ability to become more secure, trusted, or cost-effective. Hazard control processes differ from one company to the next, as well as from one task to the next. At work, a worker is exposed to a variety of dangers. So, for the next, we go to the measure in decreasing order of efficacy, which includes administration, engineering, and personal protective equipment.
Now, let's move on to the engineering control. What is engineering controls? Engineering controls are innovations or changes made to equipment, industrial facilities, processes, or systems in order to minimize the probability of the workers that be exposed to the hazard or risk of injury. So, as a safety officer in the medical services, we provide sneeze guard shield to prevent germs and viruses from spreading via respiratory droplets. Patients spend a lot of time in hospital reception areas, which are considered as high traffic areas and are often a space that contain numerous germs and bacteria. Sneeze guards will offer protection throughout this encounter, whether it's scheduling their next appointment, greeting patients as they come, or checking in before a doctor appointment. This sneeze guard technology is not restricted to reception areas. It may be used to safeguard physician, technician, and patient throughout visit. Second, the most important approach for environmental and engineering control is isolation. Patients with suspected or infected COVID-19 can be placed in airborne infection isolation rooms. Procedure involving aerosol generation should be performed on people with suspected or infected COVID-19 in an airborne infection isolation rooms. In order to keep germs and bacteria from spreading, ensure that the room's air is vented directly to unoccupied spaces outside the building, or that is passed through a high-efficiency particulate arrestant filter if it is recirculated. If airborne infections isolation rooms is not available, patients with suspected or infected COVID-19 can be placed in a private isolation ward. The isolation ward with sufficient ventilation control and regulate laminar flow of air should be available in healthcare institutions, and patients should be separated by a minimum of 1 meter from one another. And lastly, install drive-through type windows or partition for COVID-19 testing or vaccination of employees and patients. According to the University of Georgia Research, people are more likely to infect others or get infected with COVID-19 when waiting for hours to be tested or vaccinated in an indoor environment such as a healthcare facility. When engaging in a drive-through COVID-19 test and vaccination, individuals are quarantined in their cars, separated from others, and the testing and vaccinating process is carried out in a well-ventilated space. The combination of isolation potentially infected individuals in their cars and performing the test in a ventilated environment reduces COVID-19 infection to the majority of the people, thus assisting in the containment and mitigation of the spread of deadly disease. That's all from me. Thank you.
Next, we move to the administrative control. What is administrative control? It is a control that changes how people perform their work. In other words, administrative controls are used to direct people to work safely. It is divided into two measures, which are safe work practice and administrative controls. Safe work practice consists of the company's general workplace rules so that employees' exposure to hazard can be reduced. Meanwhile, administrative controls are measures that other than safe work practice. So as COVID-19 occurs, many administrative controls have been implemented by the government to stop COVID-19 from spreading. So from this event, we can see that administrative controls in medical service are necessary to prevent COVID-19 transmission. So as the safety officers in the medical service, we must educate our staff on the do's and don'ts during this pandemic. So the administrative control that can be done is by encouraging workers to practice social distancing that has been regulated by our government, which is 6 feet apart or 1 meter. So by practicing social distancing, exposure to COVID-19 transmission can be reduced. Company also can conduct a safe work practice to employees so that administrative control are successfully effective. For example, by instructing employees to just stay at home if they are feeling unwell, encouraging them to practice hygiene, which is washing hands with soap for 20 seconds and using hand sanitizer frequently. Employees also are encouraged to wear double face masks when they are in crowded areas, such for example when they are having a face-to-face meeting. Second is by providing a policy and procedure for both employees and visitors to comply. Our company should provide visual alerts such as poster and signage in language that both employees and visitors can understand. As we in Malaysia, it's important to provide a multi-language poster and signage since Malaysia has so many ethnicities. The content must include the sign and symptom of the COVID-19 and the person in charge they need to refer if they do have the symptom. It also must contain a warning or instruction. If they do have the symptom, they cannot enter the facilities. Next is providing training. For example, employees must be taught a proper hand washing. So for those workers that need to apply protective equipment and clothing, they must be trained on how to wear it and how to take it off correctly. Because the inappropriate handling might be a hazard to them since the virus can be anywhere around us. The training material and information must be easy to understand and suits the level of literacy of all employees and visitors so that miscommunication can be prevented. In addition, the company must also encourage safe food practice to reduce exposure to the virus COVID-19 so that employees are aware of the virus and they can prevent it.
According to Occupational Safety and Health Administration, OSHA of the United States Department of Labor, equipment used to minimize exposure to hazards that cause severe job injuries and illnesses is the personal protective equipment, commonly termed personal protective equipment (PPE). Casualties and diseases can be caused by chemical, radiological, physical, electrical, mechanical, and any other hazard at the workplace. Items such as gloves, protective goggles and shoes, earpieces or mouth, hard hats, respiratory or coveralls, vests or full body suits may form part of personal protective equipment. The design and construction of all personal protective equipment should be safe and reliably maintained. It should be comfortable for employees to use. If the personal protective equipment does not fit correctly, it can distinguish among safe coverage and dangerous exposure. In the absence of sufficient as well as feasible engineering, work practices and administrative controls, employers must supply their workforce with personal protection equipment and making sure it is proper application according to OSHA. As a safety officer, I have created a guideline for hazards control of personal protective equipment for the staff in workplace. Situational awareness is therefore essential to protect the health of doctors, nurses, patients, and the general public. The awareness of situations help hospital staff and visitors to know how much PPE they must wear, like a gown, glove, facial shield, or respirator in each patient. For example, at the patient room, which provides direct care to COVID-19 patients, staff must wear medical mask, gown, glove, and eye protection. Meanwhile, during aerosol generating procedures performed on COVID-19 patients, they must use respirator N95 or KN95, gown, glove, eye protection, and apron according to World Health Organization. Next, staff should understand how to properly set on and take off PPE to properly protect themselves and others in healthcare environments. The staff must follow specific protocols to give and doff PPE prior to the actual patient has entered the room in order to avoid potential exposure or contamination. Donning and doffing are a process based on thoroughness which must accustom to all profoundly. In healthcare environments, I will provide guidance on the sequence to place and doff pieces of PPE. Both actions are step-to-step processes in which employees must put equipment on and off in a particular order. When putting on PPE, staff must ensure that it fits properly, that it is properly affixed, and that there are no discrepancies that would allow it to be infiltrated. After the patient has been treated and the medical staff has moved from the hot area or hazardous area to the warm area or transition area, the gear should be removed one layer at a time. The final is equipment disposement. Once the equipment has been removed, it must be disposed of properly to avoid potential bloodborne pathogen exposure as well as other contamination. There will always be the likelihood of cross-contamination with any form of contaminated waste. Therefore, any medical waste must be properly discarded but also disposed of according to OSHA. The waste of disposed in containers that must be emptied when they reach 3/4 capacity. Clinical waste disposal is governed by state regulations. Sharp objects such as syringe and other medical equipment are subject to specific OSHA record-keeping requirements, in addition to PPE. Hospital staff must ensure that all medical waste is disposed of safely and securely, not only for the sake of employee safety and health, but also for the sake of patients and the general public. The presence of used medical equipment lying around or in a readily available area harms the safety and health of others in the treatment center. The whole wide world was shaken with the new variant of coronavirus, which is COVID-19, during the end of 2019. It started to get worsened during February to March 2020, where a lot of countries decided to do immediate lockdown to curb this pandemic. This whole situation has changed everyone's life 180 degrees, as people need to wear masks regularly, use hand sanitizer, and keeping distance at 1 meter away. They need to get rid of the old lifestyle with hugging, touching friends and family, as anyone can be the carrier of COVID-19. It is truly saddening to see the world is in this chaos. The busiest people during the pandemic would be medical workers because they are the pillars of the whole country. Since they are working with infected people, they are at a higher risk to contact COVID-19. Therefore, every safety officer in medical field must develop a guideline for them in order to ensure safety and health, also prevent any spread of the virus. The guideline has a few objectives to be achieved by medical workers so everyone can stay calm during this sickly time. For example, one of the objectives of the guideline is to arrange working hours properly so the medical workers will not be overworked and feeling burnt out. As an officer, they need to create a comprehensive guideline according to hierarchy of control because it is used as a means of determining how to implement feasible and effective control solutions. In this report, we have used engineering, administration, and PPE as it is more suitable for medical workers to follow, and it is impossible to control a hazard using just one of the controls. It is also important to know the hierarchy because the lower the control in the list, the less effective that control is. In conclusion, understanding, comprehension, and implementing the hazard control hierarchy will contribute to a safer workplace. Of course, the control hierarchy is useful to more than just officers and directors. The hierarchy of control is a method of choosing risk control measures which staff members at all levels of a company should use for the sake of everyone else. Thank you.